My name is Rashid Ngalawango. I'm a military medical officer. Currently, I'm a final year Master in Medicine in Radiology Trainee at Queen Elizabeth Central Hospital, registered under Kamuzu University of Health Sciences. Well, it's a mixed bag of feelings. Excited, the journey has been a long and gruesome one. At the same time, a little bit anxious because now to be able to practice without supervision, without direct guidance, it's going to be a challenge, but then also looking forward to the exam. So it's been an exciting journey. So us, we were the very first to be introduced into the program. So when we were coming in, most of the equipment wasn't here yet, and we only had one radiologist on the ground. So it was a little bit challenging, especially on the onset. So it took the coming in of various partners, such as Worldwide Radiology, who helped us source some of the equipment, and then the introduction of the various online teaching sessions as well. As much as the consultant who was on the ground at the time was doing her best to teach us as much as possible of the things she knew, it was really important for us to be exposed to a variety of subspecialties and a variety of skills and a variety of experience as well. So these teaching sessions have been very pivotal in making sure that we experience a wide array of teaching and skills that has impacted our practice and eventually directly improving our reports and impacting our patients as well. So it's been a very interesting and very important input into our education. Yeah, so like I mentioned previously, the faculty on the ground has been significantly limited in comparison to what a normal standard MMed program is supposed to have. Of course, the online sessions have been impactful, like I already previously alluded to, but then actually now having the consultants on the ground, it's more important and has been significantly impactful as well, in the sense that you can directly get feedback and you can have a more direct discussion, more direct interaction, and then they can continuously give you the basics that they think are very necessary for you to know. And then for the past years, we have been having visitors who have been here for almost 2 weeks and varying periods of time. So that has been very helpful as well. We have had specialists in breast imaging, musculoskeletal, chest, and GIT imaging, which has been very important in our education as well. So it's a very important program, especially in Malawi, where we have very few radiologists on the ground, and these ones coming in, they help to boost the workforce and help us acquire the necessary skills as well. Yeah, so when we heard that we had finally successfully won the grant, we were very excited. Because, as I said, being the first of its kind and in its infancy, the program, as much as it has been significantly successful, there are a lot of challenges as well. There are various subspecialties that we haven't necessarily been exposed to. For example, we have nuclear medicine, breast imaging, and some other, as well as interventional radiology and some other areas which we haven't fully been exposed to per se. So this opportunity will be an opportunity for us to experience what a fully equipped radiology department works in a setting where resources are not constrained. And I'm of the view that we'll be able to assimilate knowledge from the faculty on the ground in South Africa for us in order to consolidate what we have already learned here. If there are any gaps to fill, to be able to become radiology consultants that can actually compete on the world scale as well. Yeah. So with regards to skills, for me personally, I have an interest in interventional radiology. Of course, we have had visiting lecturers who have taught us some basic skills in some of the techniques in interventional radiology, and we have been practicing some of these techniques of using ultrasound, and they have been pivotal in improving our patient care. But then there are other more advanced skills which we haven't been exposed to, and also when it comes to breast imaging and other radiology interventional techniques that we might be taught. So this is a particular field that I'm very interested in, and I'm of the view that when we go to South Africa, it's something I would be able to learn, and when we come back, we might use some of these basic skills. Despite Malawi being a resource-restrained environment, we might be able to start practicing some of these services, and in the future start lobbying for provision of better settings as well, where we might be able to provide these services to our patients. Now, 3 of us will soon be graduating. We have our junior radiology registrars who joined the program after us. So the numbers are really increasing. We now have 2 radiologists on the ground who are helping with the program, a lot of partnerships that are still being built. And then now we have the EKFS grant as well. And then there are plans to recruit even more radiology registrars. So in a few years, as more of us graduate, we'll have more radiologists, the faculty will grow, the practice will grow as well. The Malawian population will be able to get a better service when it comes to radiology. So I'm very excited and looking forward to being part of this amazing development. So for the radiology service in Malawi to start to begin with, it took a lot of collaboration, both from external players as well as the government and its various funders. And that's why we were able to achieve what we have achieved thus far. That being the case, I'm of the view that for growth to occur even further, there are a lot of areas that need more assistance. For example, the coming in of more faculty, increasing the frequency, and then the online sessions as well, in order for us to have sustainable sessions online. And then there are other areas that might need beefing up on the ground, like for example, having more workstations and having more portable ultrasound machines that we can use when we are doing the ward or the bedside ultrasound scans, and other areas that might need beefing up with regards to the radiology service in Malawi. For example, maybe in the near future, setting up an intervention suite as well, in order to make sure that we are learning as well as being able to provide the service to our patients. So those are some of the areas I can think of that a funder might come in and help beef up those areas. Yeah, so that's essential for long-term capacity, because one, despite that some of us will be graduating and having 2 radiologists on the ground, they are still not enough, especially when it comes to educating larger cohorts of students. So we still need the visiting lecturers to be coming. We still need those online sessions to be coming. Not only for the fact that we want to produce world-class radiologists, but then the diversity also improves your actual clinical practice, because you are able to consolidate various things you learn from different individuals and you are able to map up the direction of your own practice. So I think in the meantime, this is still very pivotal, maybe to a certain time that will come whereby we'll be a fully equipped radiology network in Malawi that will be able to take over and continue with the program as it stands.